Hi, you guys. Welcome to another wonderful interview. I have an amazing expert today who's going to be talking to us specifically about female athletes dealing with particularly lifting weights, and really progressing an exercise program when they have prolapse or other types of pelvic floor dysfunction. So what I'm going to do is introduce Dr. Julie Granger, and she is here with us today. So Julie, say hi.
Hi, everyone.
I'm so excited to have Julie here. She is a doctor of physical therapy at, I'm sorry, my cat was just jumping down.
Fun. My dog's over here.
Animals everywhere. She's a doctor of physical therapy and a colleague of mine in the online space. She also has a clinic as well. So she is a sports board certified in sports medicine, correct, Julie?
That's right. Sports physical therapy. Mm-hmm.
Sports physical therapy. So she really knows her stuff, and really she knows her stuff particularly because she is an athlete herself. She's a very accomplished swimmer and just is very interested in sports medicine and sports therapy. That is her practice. So I want to, Julie, maybe you can tell us a brief bit more just about yourself, and then I'll read the question and we can dive right into answering it.
Sure. Yeah. Thank you. I swam in college at Duke University here in the United States, and I was always a very, very high level athlete. And when I got out of college, I was like, I definitely know for sure I want to work with female athletes. I did my college thesis in psychology on female athlete triad. I've always been doing research on the triad and relative energy deficiency in sport. And so really this high achieving, high functioning athlete is really my wheelhouse. I love it. Love working with them. And if I had to pick a niche, I'd actually say teenage girls are my favorite type of female athlete to work with, but I don't really discriminate. I like all female athletes, especially like pregnancy, postpartum, where we start to see just, you kind of lose your body identity and you want to get back to that really active lifestyle that you might have had before, or you might want to try something new. So we see that in those times of transition. So I love it. And I think working with the high level athlete is a little ominous to some people. It's hard. Like, what do you do when this person has pain or has a problem, yet they want to go do something seemingly crazy, right? And the good news for everyone listening is there's hope, and that you can actually do almost anything you want within reason. Yeah.
Perfect. Okay, well, I love this. And of course, particularly with my YouTube channel, we're talking a lot about pelvic floor dysfunction. A lot of women come to FemFusion with pelvic organ prolapse, diastasis recti, that kind of situation, weakness in the core area, right, or there's over amounts of tension. So this specific issue that we're talking about is a great question that I got from a actual FemFusion viewer. So I'm going to go ahead and read it right now, and then I'm actually going to have Julie answer it. So I'm going to go ahead and read it, and then Julie will chime in. So here's the question. It says, I'm really curious what you would say specifically about the female athlete who does strength training and lifting. I engage my core in conjunction with breathing. So she describes this by saying inhaling and relaxing, and then she exhales and draws in, zips up with every single lift. So in other words, she's doing everything right. She says we're talking about compound movements like deadlifts, squats with a barbell, overhead presses, etc., as well as isolated lifts with biceps, triceps, etc. To be clear, I'm not talking about lifting at a 1 rep max, which I know would be too heavy for someone who has had core-related issues in the past. Just 50 to 70% at a rep range of 5 to 12 reps. Anyway, I'm really curious to see what advice you have specifically for the female athlete who is overcoming or who has been through these issues and is well past the beginning stages of recovery. I have found very little resources that talk about female athletes as well as those who are in the more advanced stages of recovery and ready to take things to the next level. So that's the question. I thought it was amazing. And I told Julie before the call, I am more comfortable with working with women who are in maybe the beginning and intermediate stages. I don't work specifically so much with athletes that are at a higher level and really wanting to push things. So go for it, Julie.
So first of all, I think this is going to be a really global statement to make. So to all of Brianne's amazing viewers out there, I will always say you want to consult with a physical therapist or a strength and conditioning specialist who really understands the female athlete or the female body. or someone who does have some type of core related issue like diastasis or pelvic floor dysfunction. However, there is a growing body of conversation, I won't say research, but conversation coming around the fact that you actually could do a 1 rep max if you have a dysfunctional core problem. The thing is doing it in the right way for your body. So we talk about alignment, we talk about form. I love this part about exhale on exertion, right? Inhale to relax, draw in, zip up, kind of pre-tense the core. That's great. Yeah. There's a way to do that within even more higher level activity. Okay. And the way to get there from the more beginner stages to the higher level is to start building bridges. And by building bridges, what I mean is, well, let's pretend that you want to do something like a deadlift, right? And let's say 50 to 70% is where you want to go. So maybe you really don't want to get to 1 rep max. Well, you're going to start, let's say you're just doing like kettlebell deadlifts for now, right? Well, let's start to graduate that kettlebell even in tiny incremental phases so that maybe you can get up to the bar, which in some cases is lighter than the heaviest kettlebell, right? But it's a different, slightly different posture when you're going to be holding a bar versus a kettlebell. And then see if you can add the lightest weight to the bar first, and then a little bit more, and then a little bit more, and then a little bit more. So it's just as with any other exercise program, we want to start small and then slowly build, making sure that as you slowly build, you're still able to maintain that great breathing and pre-tensing of the muscles. So those muscles are designed to be able to equip you and keep you nice and strong pretty much at any weight level.
Okay, I love that. So essentially, it kind of reminds me of when I used to have patients who were just starting out on their recovery journey, and I would say, okay, we're just going to go for a walk. You know, I'd like you to go for a walk. Yeah. But if you think you can walk for 5 minutes before you're going to feel pain, if that's what your mind says, I can do 5 minutes, then actually let's have you walk for 3 minutes so that we don't push past. It's like you take little baby steps so that you're pushing the envelope always, but you're never pushing past accidentally. Is that similar? Okay.
That's exactly right. Yeah. And for anything in life, generally, if we set a goal, all right, I want to start lifting at 50 to 70% of 1 rep max. Well, I'm going to start at 20%, right? That's where I want to go. And I know I could probably go do that today. That's how most athletes are, is they've got the end in mind, and they are strong and they are really capable. So we're not questioning that. It's a matter of setting yourself up for success and setting those little baby steps along the way. Yeah.
Yeah. Oh, yeah. And it's true with an athlete. I would not consider myself an athlete at all, but I'm fit. Like, I'm definitely fit. And I have a mindset of fitness and pushing myself for sure. And I would say that when you are of the athletic persuasion or the fitness persuasion, sometimes you don't know your limits very well. You think, again, that example of like a 5-minute walk or a 70%, whatever, 50% rep. But I know that I actually hurt my back at the gym, doing weights, because I don't normally lift weights at the gym. And I was feeling so good. Like, man, that power was in me. My chest, I don't know. I was like pumped up. Right. And I don't normally do this. And so I was feeling great though. And I just went for it. And I was like, man, I'm going hard. And I hurt myself. And honestly, to this day, I'm still nursing this back injury that I just pushed myself too hard. So it's very easy to push past that limit. So I love your idea of bridge building and, going slower than you think you should. So, okay. Yeah.
Was there, go ahead. I was just going to say that it's so hard for some athletes, especially myself included, to be okay with that, right? And it's like we just want to start doing it. We're really motivated, and that's super honorable, right? To have this long-term goal. And we've always heard short-term goals, right? Like little baby steps along the way. The key and the trick here is to have the patience with ourselves to do a workout maybe that doesn't feel crazy challenging to our physical bodies, but the trick is to make it crazy challenging to your mind. And I always call that brain sweat. Right? So your body might not be feeling like it's really sweaty and getting a burn, right? However, if you are working on building yourself up in baby steps, it actually will make it pretty easy to get there. So you can get to that point where it's almost always a challenge.
I love it.
Stay patient.
Yeah. Yeah. Do you have any specific tips for that brain burn and anything that you'd like to add to that?
Yeah, so I am actually first, before I became a physical therapist, I'm a Pilates teacher, and I use the principles of Pilates even with high level athletes, which is concentration, control, breathing, which we already covered, precision. So really being so concentrated and mindful and focused, which requires an amount of body awareness that is very specific to make sure that we've got the right alignment, we're going slow, we're incorporating the breath and the pre-tensing of the core and those types of things to really get ourselves there. So it's almost like a self-loving, self-care approach to each and every repetition.
Mm-hmm. Okay. I love that. I love that. And is there anything specifically that you would say that people need to be aware of that we haven't already covered for form? Specifically, let's say, I'm not actually sure that this particular reader was dealing with prolapse. She just talked about core dysfunction and pelvic floor dysfunction.
Right.
But assuming it was prolapse, is there anything that you can think of that would be something people really need to keep in mind? Assuming we're dealing with that, let's just say actually an inner core weakness issue rather than an overactivation, overactivity. Let's say it's a laxity, weakness type of issue.
That's such a good question. And there's such a loaded answer to that because it really depends on who you ask. So there's lots of good research and information coming out in the female athlete world and in the lifting world, especially when it comes to core dysfunction, that kind of goes against what we used to think about what we'd say is traditional core weakness and how we want to address it.
Okay.
So just to cite a couple of experts out there, just to offer a couple more resources for people. First of all, if it's something like a diastasis recti, what we're starting to learn is that some of these more abdominal-based exercise things aren't necessarily a bad thing. Again, it's just making sure that the athlete has taken the baby steps to be set up for success to start doing them without harming, or not, I hate the word harm, but just stressing out the linea alba or the abdominal wall there.
And is this because of the inner core container working together as a unit?
Yeah.
So really needing to focus on the pelvic floor and the entire core connection, not just tightening down the upper abs, say, which can actually create downward pressure.
Right.
Okay.
Right. And so some of the work that came out, I believe it was about 2 years ago now, by Diane Lee and Paul Hodges. Diane Lee is a Canadian physiotherapist, brilliant when it comes to everything having to do with the core canister. In fact, it was her term, the core canister. Paul Hodges is an Australian physiotherapist and researcher who does tons of work on this sort of core stability work. He's been doing it for decades now. They got together and said, well, actually, just as with any other ligament or musculotendinous injury, the linea alba, that thing that gets stressed in diastasis recti, we actually need to stress it just to a point so it can start to remodel its collagen structure and become a little bit stronger with exercise. And so it means, yes, kind of incorporating all of the components of the core canister, the diaphragm, the pelvic floor, the multifidus, the transverse abdominis, incorporating proper alignment of the thoracic spine, the pelvis, and things like that. And layering on top of that, the work from Julie Wiebe, who's out of California. She's also a physiotherapist. She's brilliant. When it comes to women's health and female athletes, she does a great job of teaching women the proper alignment, the proper teamwork, so making sure that all the pieces of that core canister are ready to take action. And part of that teamwork is preparation. So making sure the brain is focused so that it can talk with the muscles and tell them to do that kind of stuff correctly. And then a third physiotherapist out of Australia, Anthony Lowe, actually does a lot of work and teaching on the female athlete when it comes to CrossFit. And his philosophy when it comes to core weakness is, and not just diastasis recti, so all of it, right? Is that really, again, baby step your way up, especially with heavier lifts, and vary your types of movements that you do. So a variety of positions is really important. There's no such thing as one correct alignment for anyone. It really depends on your body, your personal range of motion, how strong your personal muscles are, your history with sports, that kind of thing, and really the right supervision. He's all about the right amount of coaching and supervision from people. So all that to say, there's just not one right answer for core weakness. There's lots of great resources. And I always say, just make sure, never be afraid to ask for help, get a coach who's really knowledgeable about this stuff. Yeah.
I agree. And I do have an interview with Julie Weed that I will link in the video notes somewhere. Information button, the video notes below. She's fantastic. It sounds like it really comes down to just like everything else, and something I'm starting to just talk about like almost on repeat, I feel like, which is it's all about knowing yourself and improving your own body awareness and knowing how to listen in to your personal limits, what feels good in your body, what alignment feels right for you, what exercises feel right for you, what you can do, what you can't do. I mean, it's kind of hard to say there. It's almost like, I feel like we got to this point that people with diastasis recti, core weakness, core dysfunction, we were like, stop doing crunches, everyone. Don't ever do a crunch again, ever, ever. And it was like, well, but we can do planks. And then pretty soon it was like, no, stop doing planks. Never do a plank, ever, ever, ever. You can't do a plank either. And honestly, I mean, I kind of fell into this too. I was like, oh my gosh, I was telling everyone to do planks and now that's not okay. And I realized, oh no, but I've come to this fine balance point in my own way of teaching people. I think that we can't keep saying, never do an oblique move, never do a twist, never do a plank, never do a crunch. I mean, you need to know how to move your body, but you also need to know your limits. If your body's not at a point where you can handle the crunch or the plank or the twist, then of course don't do it. But we need to be able to move. And so, sorry, this is just my soapbox. And
I love your soapbox. Preach it, sister.
Yeah,
I love it.
Off topic, but I think maybe it does wrap in. So I will go ahead and step down from my soapbox and let you wrap up, Julie, with anything else that you'd like to share about this topic today, about female athletes and progressing to a higher level, and also how people can get in touch with you.
Yeah, well, first of all, I'm actually going to tie your soapbox right in that I never use the word never. There's no such thing as never. There are people with disabilities who can do enormously amazing things. And I don't like to look at core weakness as a disability. It's just part of your current abilities. And you're on the path to getting stronger, right? So I think sometimes we in the professional world, we get a little scared ourselves and we invoke these scare tactics and we buy into them. And I think for athletes, when they hear don't, they are either going to get so scared that they literally fall off the horse completely and they're so afraid to move forward with any amount of strengthening, or they walk away from you and find someone who will tell them what they want to hear.
Oh, you're so right. Yeah.
Right.
Yeah.
So the athletes are driven, right? They're like, and sometimes they're a little fearful too. So we have to take that in mind. And I think that with strengthening, we're starting to hear, right? We bend over and touch our toes. We twist in life. We do things. So why not strengthen and train the body to be able to handle those things, right? Yeah. And when it comes to great bone health, when it comes to good tissue integrity, we want to stress our tissues in a variety of ways so that when we find ourselves with the dog on a leash pulling us across the street, which happened to me yesterday, I'm not going to blow out my ACL because I've trained my body and it's prepared for that high level activity, which by the way is like an Olympic sport. Walking a dog. So, I mean, it's so important not to be afraid, but again, to take those baby steps. I think that if we take any other take home from this, don't be afraid to ask for help. Don't be afraid to move forward, and don't be afraid to be patient and take baby steps.
I love it. I love it. Wonderful. It's perfect. Well, how can people get in touch with you if they'd like to know more about the work you're doing and connect with you?
Yeah, so I do physical therapy, as you said, for female athletes. I'm also starting to do women's health coaching, integrative women's health coaching, nutrition coaching for young female athletes and their families, really, but really just any female athlete qualifies.
The Integrative Women's Health Institute?
Yeah, Integrative Women's Health
Institute. A fellow alum then.
Mm-hmm. Yeah.
Wonderful.
And so the best place to get in touch with me is currently on my website, which is PRISM, PRISM, wellnesscenter.com. Or you can actually get me on Instagram. I spend a lot of time on Instagram, which is at Dr. Julie Granger, JulieGranger. And it's DR, not DOCTOR, so at Dr. Julie Granger. And then Facebook, it's at Prism Wellness Center as well. So those are great ways to get in touch with me for sure. I love to hear from everyone. I love anything when it comes to female athletes, and really just helping female athletes get the right direction.
Oh, that's awesome. I love your energy, and I think that anyone who connects with you is going to be very happy. So thank you for agreeing to be part of this show today, and thank everyone for watching.
Me.
Yeah, of course. I hope questions were answered, and I hope this was helpful. So everyone, I'm going to sign off. Remember, as always, eat clean, move every day, and you will shine brighter. Thanks again, Julie. Bye.
You're welcome. Bye.